What if I told you that a single vitamin, one that most doctors rarely even test for, has been shown to reverse nerve damage in as little as 14 days, even in people over 60 years old? I know that sounds almost too good to be true. I know you've probably heard 100 different claims about miracle supplements and wonder cures, and I completely understand your skepticism. But stay with me here, because what I'm about to share with you today is not some internet myth. This is backed by clinical research, by real patient cases, and by decades of neuroscience that mainstream medicine has largely overlooked. My name is Dr. Clarence Martin, and if you've been suffering from tingling in your hands and feet, if you've been waking up in the middle of the night with burning sensations running down your legs, if you've noticed your balance getting worse or your grip strength fading, or if you've been told by your doctor that nerve damage is just part of getting older and there's nothing you can do about it, then this video might genuinely change your life. I'm not exaggerating when I say that, so please do not click away. Watch this all the way through because the information I'm about to give you could be the missing piece you've been searching for. The picture most seniors know too well. Before I reveal exactly which vitamin I'm talking about, let me paint a picture for you. Imagine you're 62 years old. You used to be active. You used to walk your dog every morning, play with your grandchildren on the weekends, maybe even do a little gardening. But over the past year or two, something changed. It started slowly. A little numbness in your toes. You figured it was just poor circulation. Then the tingling started spreading up your feet and into your calves. Your hands began feeling clumsy. You started dropping things. Buttoning your shirt became a frustrating ordeal. At night, the burning sensations kept you awake, and no amount of repositioning could make it stop. You went to your doctor. They ran some basic blood work, told you everything looked fine, and maybe prescribed gabapentin or some other nerve pain medication that made you feel foggy and tired all day. Sound familiar? If it does, you're not alone. Millions of people over the age of 60 are living with peripheral neuropathy, and the vast majority of them have never been properly tested for the one nutritional deficiency that could be causing the entire problem. The vitamin I'm talking about is vitamin B12. Why I already take a multivitamin is not enough. Now, I know some of you just heard that and thought, oh, B12, I already take a multivitamin. I'm probably fine. And that right there is exactly the dangerous assumption that keeps so many people suffering unnecessarily. Here's what most people don't understand about vitamin B12. Your ability to absorb it drops dramatically as you age. After the age of 50, your stomach produces less and less of something called intrinsic factor, the protein your body absolutely needs to absorb B12 from the food you eat. So even if you're eating plenty of meat, fish, eggs, and dairy, even if you're taking a standard multivitamin every single day, you could still be profoundly deficient in B12 at the cellular level, where it actually matters. And here's the really scary part. Standard blood tests often miss B12 deficiency entirely. Your serum B12 level can come back in the so-called normal range, while your nerves are literally starving for this critical nutrient. That's because the standard reference range is far too broad. Many experts in functional medicine and neurology now believe that what's considered the low end of normal is actually already in the deficiency zone for nerve health. What B12 actually does for your nerves. Let me explain exactly what B12 does for your nerves, because this is where it gets really fascinating. Every nerve fiber in your body is wrapped in a protective coating called the myelin sheath. Think of it like the insulation around an electrical wire. When that insulation is intact, nerve signals travel quickly and efficiently, from your brain to your fingertips, from your spinal cord to your toes, from your organs back to your brain. Everything works the way it should. You feel things properly. Your muscles respond correctly. Your balance stays steady. But when your B12 levels drop below what your nervous system needs, that myelin sheath begins to deteriorate. It starts breaking down. And when the insulation around your nerves degrades, those electrical signals start misfiring. They get delayed. They get distorted. Sometimes they fire when they shouldn't, which is what causes that burning, tingling, pins and needles sensation. Sometimes they don't fire at all, which is what causes the numbness. Over time, if this deficiency is not corrected, the nerve fibers themselves can become damaged, and eventually that damage can become permanent. That's why catching this early and addressing it quickly is so incredibly important. The 14-day turnaround and why it's real. Here's where the story gets really exciting, and this is the part I really want you to pay attention to. There have been multiple clinical studies and documented case reports showing that when B12 deficient patients, particularly those over 60, are given the right form of B12 at the right dose through the right delivery method, nerve function begins improving in as little as 14 days. I've seen it in my own experience working with patients. People who could barely feel their feet start reporting sensation coming back within 2 weeks. People who hadn't slept through the night in months because of burning pain suddenly sleeping peacefully. People whose balance had deteriorated to the point where they were afraid of falling begin walking with confidence again. And it's not magic, it's basic biochemistry. When you give the nervous system the raw material it desperately needs to repair myelin, it starts repairing myelin. Your body wants to heal. It's designed to heal. But it cannot build what it doesn't have the building blocks for. And B12 is one of the most critical building blocks for nerve repair and maintenance. Not all B12 is created equal. Here's where I need to get very specific with you, because not all B12 is created equal, and this is where most people go wrong. If you walk into any pharmacy or health food store and pick up a bottle of B12 supplements, chances are you're going to find cyanocobalamin. That's the most common and cheapest form of B12 used in supplements. And while it's not harmful, it is a synthetic form that your body has to convert through multiple steps before it can actually use it. For nerve repair. For many people, especially those over 60, especially those with certain genetic variations that affect methylation, cyanocobalamin is simply not effective enough. The forms you want to look for are methylcobalamin and adenosylcobalamin. Methylcobalamin is the form most active in the nervous system. It directly participates in the repair and maintenance of myelin sheaths. It supports the production of something called S-adenosylmethionine, SAMe, one of the most important methyl donors in the body, and plays a direct role in nerve regeneration. Adenosylcobalamin, also known as dibencoxide, is the form that works primarily in the mitochondria, the energy factories of your cells, and it's essential for producing the energy your nerve cells need to carry out repairs. Ideally, you want a supplement that contains both of these active forms. Dosing, where most people make critical mistakes. The recommended daily allowance for B12 is around 2.4 micrograms per day. That's the amount the government says you need to prevent outright deficiency disease. But preventing deficiency disease and actually optimizing nerve health are two completely different things. When we're talking about reversing nerve damage, the doses used in clinical studies are typically in the range of 1,000 to 5,000 micrograms per day, sometimes even higher in the initial phase of treatment. For people with severe deficiency or significant nerve damage, many practitioners start with B12 injections, usually methylcobalamin injections given 2 to 3 times per week for the first few weeks. Because injections bypass the digestive system entirely and deliver the B12 directly into the bloodstream where it can get to work immediately. This is often the fastest way to see results, and it's one of the reasons why some patients notice improvement in as little as 14 days. After the initial loading phase, many people can transition to high-dose sublingual B12, which dissolves under the tongue and is absorbed through the mucous membranes, again, bypassing the gut. This is a much better option than standard oral tablets that have to survive stomach acid and depend on intrinsic factor for absorption. The other key players that work synergistically with B12. Now, I want to address something really important, because I don't want anyone watching this to think that B12 is the only thing that matters for nerve health. While B12 is arguably the most critical and most commonly deficient nutrient when it comes to peripheral neuropathy, it works best as part of a comprehensive approach. Here are some of the other key players that work synergistically with B12 to support nerve repair and regeneration. Vitamin B1, specifically benfotiamine. First, let's talk about vitamin B1, also known as thiamine. Specifically, I want to mention a fat-soluble form of B1 called benfotiamine. Regular thiamine is water-soluble, which means your body excretes most of it quickly, and it doesn't penetrate nerve tissue very effectively. Benfotiamine, on the other hand, has been shown in clinical studies to penetrate nerve cells much more effectively and to significantly reduce neuropathic symptoms. It works by protecting nerves from something called advanced glycation end products, AGEs, toxic compounds that accumulate in nerve tissue, especially in people with blood sugar issues. Benfotiamine has been used extensively in Europe and Japan for decades to treat diabetic neuropathy, and the research supporting it is quite impressive. A dose of 300 to 600 milligrams per day of benfotiamine alongside your methylcobalamin can make a significant difference. Vitamin B6, a double-edged sword. Next, let's talk about vitamin B6. B6 is interesting because it's a double-edged sword. In the right amount, B6 is essential for nerve function and for the production of neurotransmitters like serotonin, dopamine, and GABA. But in excess, B6 can actually cause nerve damage. This is called B6 toxicity neuropathy. I've seen cases where people were taking high-dose B6 supplements thinking they were helping their nerves when they were actually making things worse. The key is to keep your B6 intake in the range of 25 to 50 milligrams per day, and to use the active form pyridoxal 5-phosphate, P5P, rather than the cheaper pyridoxine hydrochloride form. P5P doesn't carry the same toxicity risk and is immediately usable by the body. Alpha-lipoic acid. Another incredibly important nutrient for nerve health that most people never hear about is alpha-L, lipoic acid. Alpha-lipoic acid is a powerful antioxidant that has been extensively studied for its ability to protect and regenerate nerve tissue. It's been used in Germany as a prescription treatment for diabetic neuropathy for over 30 years. Clinical trials using doses of 600 milligrams per day have shown significant improvements in neuropathic pain, burning, numbness, and tingling. What makes alpha-lipoic acid so special is that it's both water-soluble and fat-soluble, which means it can work in every part of the nerve cell, inside and out. It also has the unique ability to regenerate other antioxidants, like vitamin C, vitamin E, and glutathione, amplifying the body's overall antioxidant defense system. For people dealing with nerve damage, I consider alpha-lipoic acid to be one of the most important supplements alongside B12. Vitamin D. Let me also mention vitamin D, because vitamin D deficiency is absolutely epidemic in people over 60, and emerging research is showing a strong connection between low vitamin D levels and peripheral nerve. Neuropathy. Vitamin D receptors are found throughout the nervous system, and vitamin D plays a role in nerve growth factor production, in reducing neuroinflammation, and in supporting the immune system's ability to protect nerve tissue. Many of my patients who have neuropathy also have vitamin D levels that are far below optimal. I recommend getting your vitamin D level tested and aiming for a blood level of at least 50 to 70 nanograms per milliliter, which for most people requires supplementation with vitamin D3 in the range of 4,000 to 5,000 IU per day, taken with vitamin K2 to ensure proper calcium metabolism. Magnesium. And I can't talk about nerve health without mentioning magnesium. Magnesium is involved in over 300 enzymatic reactions in the body, including many that are critical for nerve function. It helps regulate nerve signal transmission, relaxes muscles, reduces inflammation, and supports healthy blood flow to nerve tissue. Most people over 60 are deficient in magnesium, partly because soil depletion has reduced the magnesium content of our food supply, and partly because medications like proton pump inhibitors, diuretics, and certain blood pressure medications deplete magnesium levels. The best forms of magnesium for nerve health are magnesium glycinate, which is highly absorbable and has a calming effect on the nervous system, and magnesium L-threonate, which has been shown to cross the blood-brain barrier and support cognitive function as well. A dose of 300 to 400 milligrams of elemental magnesium per day is a good target for most people. Lifestyle factors that are just as important as supplements. Now, I want to shift gears and talk about some lifestyle factors that are just as important as supplementation when it comes to reversing nerve damage. Because you can take all the right supplements in the world, but if you're not addressing the root causes that are driving the nerve damage in the first place, you're just bailing water out of a sinking boat. 1. Blood sugar control. The number one lifestyle factor that destroys nerves is chronically elevated blood sugar. You don't have to be a diagnosed diabetic to have blood sugar levels that are damaging your nerves. Millions of people are walking around with pre-diabetes or insulin resistance and don't even know it. When blood sugar stays elevated, even mildly above the optimal range for extended periods, it triggers a cascade of metabolic damage that directly attacks nerve tissue. The excess glucose binds to proteins and fats in the nerve cells, forming those advanced glycation end products, AGEs, I mentioned earlier, which are essentially like rust forming on your nerves. It also generates massive amounts of oxidative stress, which overwhelms the nerve cells' ability to protect themselves. And it damages the tiny blood vessels called vasa nervorum that supply blood and oxygen to the nerves themselves. So if you're serious about reversing nerve damage, you absolutely must get your blood sugar under control. That means reducing your intake of refined carbohydrates, sugary foods, and processed foods. It means focusing on whole, nutrient-dense foods like vegetables, healthy fats, quality proteins, nuts, seeds, and low glycemic fruits. It means incorporating regular physical activity, which dramatically improves insulin sensitivity. And it means working with your healthcare provider to monitor not just your fasting blood sugar, but also your hemoglobin A1C and your fasting insulin levels. Because these markers give you a much more complete picture of your metabolic health. 2. Movement. The second lifestyle factor I want to emphasize is movement. I know that when you're dealing with neuropathy, especially when your balance is compromised or your feet are in pain, the last thing you want to do is exercise. But gentle, consistent movement is one of the most powerful things you can do to promote nerve regeneration. When you move your body, you increase blood flow to your peripheral nerves, delivering more oxygen and nutrients, including that B12 we talked about, to the areas that need repair. Exercise also stimulates the production of nerve growth factors, which are proteins that literally signal your body to grow and repair nerve tissue. You don't have to run a marathon. Walking for 20 to 30 minutes a day, doing gentle yoga or tai chi, swimming, or even chair exercises if your mobility is limited. All of these count, and all of them make a measurable difference. Studies have shown that regular, moderate exercise can reduce neuropathic pain by up to 30% and can improve nerve conduction velocity, a direct measure of how well your nerves are functioning. 3. Sleep. The third factor is sleep. Your body does the vast majority of its repair work, including nerve repair, while you're sleeping. During deep sleep, your body releases growth hormone, which is essential for tissue repair and regeneration. It's also during sleep that your brain's lymphatic system activates, clearing out toxic waste products that can damage nerve tissue. If you're not getting 7 to 8 hours of quality sleep per night, you're significantly hampering your body's ability to heal your nerves. I know that neuropathic pain can make sleeping difficult, and it becomes a vicious cycle. The pain keeps you awake, and the lack of sleep prevents healing, which makes the pain worse. But addressing sleep quality through good sleep hygiene practices, through managing stress, and through the nutritional strategies we've discussed today can help break that cycle. 4. Stress management. The fourth factor is stress management. Chronic stress floods your body with cortisol, which is inflammatory, immunosuppressive, and directly toxic to nerve tissue over time. Chronic stress also raises blood sugar levels, even if your diet is perfect, because cortisol triggers the liver to release glucose into the bloodstream as part of the fight-or-flight response. Finding healthy ways to manage stress, whether it's through meditation, deep breathing exercises, spending time in nature, prayer, journaling, connecting with loved ones, or whatever works for you, is not a luxury. It's a medical necessity when you're trying to heal your nervous system. A real patient story. Let me share a quick story with you, because I think it really illustrates the power of everything we've been discussing today. I worked with a patient, a 67-year-old retired school teacher. She came to me after 3 years of progressively worsening neuropathy in her feet and hands. She had been to multiple doctors. She had been on gabapentin for 2 years. She had been told that her neuropathy was idiopathic, meaning they couldn't find a cause, and that it would only get worse over time. When I tested her, her serum B12 level was at 210, which most labs would flag as normal since the reference range typically starts at around 200. but I also ran a methylmalonic acid test and a homocysteine test, both of which are much more sensitive markers of functional B12 deficiency, and both came back significantly elevated. Her vitamin D was at 18, which is severely deficient. Her fasting insulin was elevated, indicating insulin resistance, and her magnesium was on the low end. We started her on methylcobalamin injections 3 times a week, along with benfotiamine, alpha-lipoic acid, magnesium glycinate, and vitamin D3 with K2. We worked on her diet, shifting her toward a lower glycemic, nutrient-dense eating pattern. We got her walking for 15 minutes a day, which was all she could manage initially. Within 14 days, she called my office and said the burning in her feet had decreased by about 50%. Within 6 weeks, the numbness in her hands had improved significantly, and she could button her shirt again without difficulty. Within 3 months, she was walking 30 minutes a day with no balance issues, sleeping through the night, and have been able to completely discontinue her gabapentin under medical supervision. Now, I'm not telling you this story to make promises. Every person is different, and results vary depending on the severity and duration of nerve damage, the underlying causes, and individual factors. But I am telling you this story because it illustrates a fundamental truth. When you give the body what it needs and remove what's harming it, it has a remarkable capacity to heal, even after 60, even when you've been told there's nothing that can be done. Your practical action steps. Start today. Before I wrap up, I want to give you some practical action steps so you can start applying this information right away. First, ask your doctor to test your B12 level, but also ask for a methylmalonic acid test and a homocysteine test. These functional markers will tell you whether your body actually has enough usable B12 at the cellular level. Second, if you're over 60 and experiencing any symptoms of neuropathy, consider starting a high-quality methylcobalamin supplement at a dose of at least 1,000 micrograms per day in sublingual form. If your deficiency is significant or your symptoms are severe, talk to your doctor about methylcobalamin injections. Third, consider adding benfotiamine at 300 milligrams per day and alpha-lipoic acid at 600 milligrams per day to your regimen. Fourth, get your vitamin D level tested and supplement accordingly. Fifth, make sure you're getting adequate magnesium, preferably in the glycinate or L-threonate form. Sixth, clean up your diet and focus on blood sugar management. Seventh, start moving your body every single day, even if it's just a short walk. An important disclaimer. I want to be very clear about something. I am not telling you to stop taking any medications your doctor has prescribed. I am not telling you to self-diagnose or self-treat any serious medical condition. What I am telling you is that nutritional deficiencies, particularly B12 deficiency, are a massively underdiagnosed cause of nerve damage in people over 60. And correcting those deficiencies can lead to remarkable improvements that many people never thought possible. You deserve to know this information. You deserve to have a doctor who looks beyond just managing your symptoms and actually investigates the root cause of your nerve problems. And you deserve to know that there is hope, even if you've been suffering for years. Final words. If this video helped you, if it gave you even a glimmer of hope or a new direction to explore, please hit that like button because it helps this video reach more people who need this information. Subscribe to this channel if you haven't already, because I put out new videos every week covering topics just like this. Topics that your doctor probably doesn't have time to discuss with you in a 15-minute appointment. And share this video with someone you love who's dealing with nerve problems, because you might be giving them the answer they've been searching for. Drop a comment below and tell me about your experience with neuropathy. Have you been tested for B12 deficiency? Have you tried any of the strategies we talked about today? I read every single comment, and I love hearing from you. This is Dr. Clarence Martin, reminding you that your body is not broken. It's not just falling apart because you're getting older. More often than not, it's missing something it desperately needs. And when you provide that missing piece, incredible healing becomes possible. Take care of yourselves. Take action on what you learned today. And I'll see you in the next video.